Hello, hello, welcome. Hello, welcome. So nice to see you today. I'm just going to give a few more moments for others to join and then be mindful of time. Okay, so let's get started. We have a lot to cover today. It's an important topic. So welcome. Hello. For those of you that don't know me, my name is Krystal and I am a health and wellbeing consultant here at Borislow Insurance. I would like to also mention that I have my team in the background. So Miss Brittany is in the back and she will be manning the chat feature or the Q&A. So if there's anything that you have that you'd like to talk about, please feel free to utilize the features as we go through today's presentation. We are going to cover heart health living. And as a disclaimer, this is for educational purposes only. I am not a doctor, so if you have specific concerns, I encourage you to reach out to your primary care physician and have that discussion with them. So without further ado, let's dive in. If you're not sure what we do here at Borislow Insurance in the health and wellbeing section, feel free to reach out to your specific consultant. We are happy to offer various strategies such as culture audits and strategic planning, alternative wellness solutions, live webinars, and on-site classes such as today. We assist with health fairs and on-site demonstrations, as well as coaching and behavior modification solutions. So lots of education, lots of engagement opportunities, as well as business strategy as well. So if you haven't yet already this year, I encourage you to do so. We would love to work with you and grow throughout 2023. So today we are going to cover what an unhealthy heart is, what are some of the symptoms, the causes, and a healthy heart lifestyle. As you know, we love to focus on prevention, and heart disease is one of the major concerns in the industry and across the nation. So we would love for you to hopefully gain some insight here and learn something new maybe, and then take what serves you today in this moment. So, fact, heart disease is the #1 silent killer and cause of death. However, it is preventable and even reversible. So although that fact is a scary statistic, please know that there are lots of things that we can do to prevent it and reverse it. But first, let's get to know what it is. So I encourage you to participate. I'm going to launch a poll here. It should come up. Is heart failure and a heart attack the same thing? Again, this is just for engagement purposes. We love for you to be present in the session and hear from you. There's no judgment or anything like that. So I'll give just a moment or so. Is heart failure and a heart attack the same thing? I'm going to go ahead and end the poll and share the results. And you can see that 100% said no. So great job. Absolutely no, they are not the same thing. So what is an unhealthy heart? Clogged arteries are the major blood vessels which carry your blood, oxygen, and nutrients to the heart. Heart failure is the weakening of the heart muscle, resulting in being unable to pump those necessary blood to the other organs of your body. And a heart attack is when the blood flow stops completely and the muscle starts to die immediately. So as you can see, a heart attack is an immediate response, and heart failure is the slowly weakening of the muscle. What are some symptoms of an unhealthy heart? They look very familiar. They may look like fatigue or shortness of breath, chest pain, dizziness or nausea, or even heart palpitations. So if you notice any of these symptoms and you have any concerns, please, call 911, find your closest AED, run to the emergency room, because as you know, it is the #1 silent killer. So it is very important to take immediate action, not only for yourself, but maybe those around you, maybe your loved ones. Please don't hesitate to dial 911 and ask for help. So here, let's do our next poll. Let me launch it here. What causes an unhealthy heart? Cholesterol, plaque buildup, genetics. It's just for fun. I encourage you to participate. And I'll give just a few more moments to do so. I'm going to go ahead and end the poll here and share the results. And great job. Absolutely. Plaque buildup is exactly what causes an unhealthy heart. So thank you for participating. I appreciate it. Let's take a look at what that looks like. So begins in childhood and usually worsens over time, most commonly caused by plaque buildup in the arteries throughout the body. High blood pressure, smoking, stress, obesity, diabetes, and lack of physical activity contribute to plaque buildup. As plaque builds up, arteries begin to narrow, as you can see in the visual, resulting in hypertension or high blood pressure, because obviously the space for blood to flow has decreased and gotten smaller. And if plaque closes off the arteries, then blood, oxygen, and nutrients are unable to be distributed through the body, resulting in a cardiac arrest or a heart attack. If plaque ruptures into the bloodstream, platelets are activated and begin to control the damage with clotting, which leads to blockages, and that's what causes the heart attack or sudden death. So keep that in mind. There are many things that lead to plaque buildup, as you can see them listed, as well as the visual. And so we want to make sure that we work on trying to avoid plaque buildup, which is caused by cholesterol. It's primarily made in your liver at 80%. And it's formed with fatty acidic foods such as fried foods or fast foods. But it can also be found in animal foods such as eggs, shellfish, meat, dairy products. However, I encourage you to maybe look at a healthier version. It is found in plants, but at a very low percentage, of single-digit percentage. So it is the healthiest version when it comes to nutrition and cholesterol buildup. I'm going to encourage you to participate in one more poll in a moment before we dive deeper. So do you believe that heart disease is hereditary? Yes or no? We'll give just a few more moments to participate. And I'm going to go ahead and end the poll here and share the results. So as you can see, the majority have said yes. However, there is a little more detail I'd like to dive into when it comes to the hereditary piece. So the answer is yes and no. However, genetics plays a lesser role in heart disease than you may think. And it only accounts for about 3% of the likelihood that you will develop heart disease. 3%, that's quite small. However, the primary link is likely that you and your family members probably ate and still eat the same types of foods and maybe even have similar lifestyle habits. So it is in our lifestyle where the 97% really falls. So let's do a quick check-in. Do you personally struggle with any of these causes? Maybe high blood pressure or smoking, stress, obesity, diabetes, or maybe a lack of exercise. I am human first too. And so this is not to shame or anything, but it's to increase awareness. Maybe I should pay attention to this one to help. It might help save me one day. So let's work on prevention and reversing any poor heart health. The first lifestyle behavior that you can work on is blood pressure. So a healthy blood pressure reduces the strain on your heart, your arteries, and your kidneys. High blood pressure increases the force of blood through your arteries, which can damage those artery walls. A normal is at 120/80. The top number is the pressure in your arteries when your heart beats, and the bottom number is the pressure in your heart, in your arteries when your heart rests. So in case you haven't seen those in a while, there are lots of great tools where you can check your blood pressure right at home. And if you haven't done so in a while, I would like to encourage you to maybe know your numbers and schedule your annual checkup with your primary care physician where they will check your blood pressure. Next is to focus on your cholesterol. So kind of following along the lines of knowing your numbers, if you go for an annual checkup, your doctor will check your cholesterol as well. So cholesterol contributes to the plaque, which clogs arteries. Clear arteries help the heart function with ease. There's HDL, which is the good cholesterol, and keeps the LDL, which is the bad cholesterol, from sticking to your artery walls. The good cholesterol helps your body remove excess cholesterol. It's your body's natural creation of cholesterol. However, the HDL self-destructs, which is beautiful. The LDL creates cholesterol. However, it is created from the intake of food. So like we looked at earlier, those fried foods, the fatty foods, the animal products, they all contribute to the bad cholesterol because your body naturally creates it with the HDL on its own. However, it self-destructs. Next, when knowing your numbers, is also taking a look at your blood sugar. So food is turned into blood sugar that our bodies then use for energy. High blood sugar damages the blood vessels and the nerves that control our heart. Over time, high levels of blood sugar damages not only your heart, but also your kidneys, your eyes, and your nerves. So I'd also like to point out to, when you're going for your annual checkup with your doctor, that sometimes it's also really helpful to go for your vision exam because your eye doctor can also see some of these early signs as well. Next, I'd like to encourage you to take a look at physical activity. So it is recommended 150 minutes of moderate exercise or 75 minutes of vigorous exercise, or of course, a combination of both. Kids as well should get 60 minutes each day, and it improves your muscles' ability to pull oxygen out of the blood, reducing the need for the heart to pump more blood to your muscles. It also reduces stress hormones, which slows your heart rate and lowers your blood pressure. So as you can see, physical movement is really benefit to your heart and its healthy function. I'd like to encourage you maybe to take a moment to just pause and think about maybe what exercise did you like to do when you were a child, when you're a kid. I encourage you to maybe put it in the chat or just think to yourself, what did I like to do when I was a kid? Maybe that looks like riding a bike or just simply being outside and walking around. Maybe it was walks after dinner. Just know that sometimes doesn't feel like exercise, although has all of the same benefits that we just talked about. And then next is nutrition. So nutrition is one of the best defenses against cardiovascular disease. You can dramatically lower your cholesterol and blood pressure just by changing what you eat. Plant-based foods focuses to help improve the health of your arteries and improves your gut bacteria. So I encourage you to maybe think about maybe possibly reducing animal products and byproducts, as they have a high contribute to plaque buildup, therefore resulting in heart disease. So I'm a big fan of, there's no specific diet or restrictions. However, maybe there are some options that you can see in the grocery store. I feel like the options have expanded over the last few years to include alternatives. So I encourage you to do so, maybe for your favorite foods or your favorite snacks, and see if there's an alternative that is available to at least try. And then if you like to watch some movies, I encourage you to just take a look at watching Forks Over Knives. It's very, very informative when it comes to the physical health impacts and risks when it comes to the nutrition and the food that we put in our body to nourish ourselves. Next is weight. So losing any excess weight can help reduce your blood pressure. It helps reduce the strain on your heart, your lungs, your blood vessels, your skeleton, and then less blood volume to push through your physical body. So as a micro challenge, 5% weight loss is a great starting goal, and maybe taking a moment to see what 5% is for you. And I'll give you a moment just to do so. It's interesting to kind of relate it to yourself and how you feel about, okay, if I, was a few pounds less, that has a big impact, as you can see on the list on the slide here, but also how much blood my body needs to move through on a daily, regular basis. And next, I would really like to focus on toxins. So reducing alcohol consumption lowers your blood pressure. Tobacco and alcohol both increase your blood sugar. And if you quit within 1 year of, if you quit smoking or vaping or any tobacco use within 1 year, your risk of heart disease actually decreases in half, which is huge. So I know that addiction is also something that we talk about a lot here in this space. And with the pandemic, some of those, per se bad habits or self-destructive behavior have come into play. And so taking a moment to just see the benefits of maybe reducing that or eliminating those toxins from your body, how that could have a huge impact on your heart health. So not only with blood pressure and blood sugar, but also reducing your risk in half. So maybe take a moment to think about how many times you might use tobacco or consume alcohol in a day or week, and just to be mindful of maybe where to start and where to go. So I would like to share one last poll with you. Oh, maybe. Okay, so I apologize. It's not letting me launch it. However, I'm going to encourage you to use the chat. So which lifestyle change will you like to work on today? Is that blood pressure, cholesterol, blood sugar, knowing your numbers? Is that physical activity, nutrition, weight, or toxins? So again, I'll encourage you to use the chat feature. Which lifestyle change would you like to work on today? Maybe it's knowing your numbers, physical activity, nutrition, weight, or toxins. Thank you so much. I love to see the participation. That's great. Oh my God, absolutely. Blood pressure check. Nutrition, that's a huge one. We are required to eat every day, so that's an easy one to kind of just take a look at. Absolutely, I love the exercise. As a child, the riding a bike and walking, dancing, jumping rope. I love these. These are great. Oh my gosh. So I would just like to finish, and as a reminder, individuals with high blood pressure, high cholesterol, diabetes, smoking habits, or who are overweight have an increased risk of heart disease. Medications and surgical procedures address the immediate concern and not the root cause of the problem. Just as lifestyle factors can cause heart disease to develop, they can also cause it to reside. So I would like to encourage you to, spend time with that 97% versus the 3% to really invest in yourself and your well-being, and to use all of these options and lifestyle behaviors to either prevent heart disease or to reverse any concern or risk if you may be leading towards that path. I hope that you found this to be engaging and you learned something new, and have been inspired to, pay attention and invest in your own well-being, at least just for today. But thank you so much for joining us today. I appreciate you being here. If you have any questions, we will stay on for a few minutes, but I encourage you to reach out to the health and well-being team here at Borislow Insurance. And thank you so much for participating. It was nice to see all of you. Take care.